I think some of this is recognizing that, you have to take advantage of local opportunities. So, for example, the current dialogue on defunding the police and less reliance on the police here in Toronto for crisis response is an opportunity to articulate what do we need to have on the ground in Toronto to make it much less likely that the police are going to be called. So, for example, the Gerstein Center does a fabulous job on crisis response in downtown Toronto. There is a crisis team in Scarborough, but there isn't anything in North York and Etobicoke. So how do we plug that gap? And then, some of the work that CMHA Toronto, that Frank and Michelle are leading with the Northwestern Toronto OHT is focusing on what can we do to keep people from being readmitted to hospital, because we found that people with repeat admissions for psychosis weren't able to be connected for any long period with community mental health programs. So they went off their medication, and that usually resulted in an involuntary admission, likely brought by the police, to Humber River Regional Hospital. So now what we're doing is we're taking the stepped care work that we've been doing successfully in Scarborough, which has actually made the Scarborough hospital system able to not be at 85% or more capacity. They actually have surplus psychiatric beds in Scarborough because we're doing the work in the community, keeping people out of hospital. So we're going to be doing more of that in Northwestern Toronto. And again, that notion of spread and scale. But at the same time, we need to say to the city of Toronto, you, unlike other communities, let's say in North America, like New York City and Philadelphia, who have $1 billion mental health budget on their own and can commission and fund services, that's not the way things work here in Ontario. So in Ontario, you need the provincial government to step up and make an investment. And that's where we need to work with our colleagues at Addictions and Mental Health Ontario and CMHA Ontario and Children's Mental Health Ontario, working together to make the case that this is a question of scaling up the kinds of innovative, effective programs that we know make a difference in people's lives. I go back to the example I gave earlier. We've been able to reduce hospitalization among people who can access assertive community treatment programs by 82%. That's pretty impressive, and it saves the government money. Our mental health and justice services keep people from out of jail and from repeat offenses. Our forensic work, which we can be very, very proud of, is able to take people who were long stay patients at CAMH and over a 2 to 3 year period, connect them in a meaningful way with housing and supports in the community. And the recidivism rate in that program is very, very low. And so that also does some work for stigma, because it shows that you can have serious mental health issues that got you in trouble with the law, but if you get the right kind of treatment in the community and the right kind of supports in the community and housing in the community, you can get your life back. And I think we have to just continue to give that message. And we have to work collaboratively with colleagues and funders at the local level here in Toronto, but also provincially and also nationally. We need to continue to say to the federal government, while we appreciate the $500 million a year that you've now committed through the health accord, that's still 2.6 billion short of what we actually need. And I think we're going to need to stand up across the country to the provincial governments, which have been making clear to the province they want to return to unconditional health transfers, where they won't have to spend money on mental health. They'll be able to do what they have usually done, spend it on doctors and hospitals. So I think the advocacy needs to continue. I think people need to keep our collective eye on that ball. But I think we're in a much stronger position than we were when I began this work, because we've actually got evidence that we can make a difference.